Have you ever been told that your blood counts are dangerously low and suddenly everything in your life changes? This evening, I want to tell you the story of someone I call David. David was 58 years old and he loved fishing. He never missed one of his granddaughter's soccer games and he rarely went to the doctor because he didn't believe in medicine. Um, David unfortunately started getting sick. He wasn't feeling well, and when his primary care physician found out that he had been hospitalized because he fell down in a parking lot, he eventually agreed to have some blood work done. They went ahead and did a CBC, which is complete blood count, and unfortunately, his CBC was abnormal. He then told everyone that yes, I've been having some sinus infections and bronchitis, and unfortunately, every time he got sick, he wasn't getting any better. And so eventually, his wife convinced them to go and have additional testing done. And his primary care doctor told me that he's only going to keep telling you I'm fine every time you ask him a question. So David's story basically started by doing a CBC that showed us very abnormal blood count. He agreed to see me. As a matter of fact, it was a telemedicine conversation, and I talked him into doing a bone marrow biopsy to determine what was going on because all his cell counts were low. We used a needle to do his bone marrow biopsy that really is kind of like having lidocaine injected in a bone, numbing the bone, and then with a needle, you get a sample of the bone. And under the microscope, he had cells that had a hair like projection coming out of them. Ironically, it is called hairy cell leukemia, which is what he ended up having. They're tiny hair like projections that you can see under a microscope. They're quite rare, they're slow growing. It's a type of cancer that usually happens in B lymphocytes. And the reason he was getting sick is because instead of dedicating his white blood cells to fight infection, he was dedicating his white blood cells to grow these abnormal hairs that weren't really of any use. And he soon after told me that he wasn't eating as much as he used to. And when I examined him, I noticed that his spleen, which is the organ across from your liver, right under your heart, had gotten bigger and he was pushing on his stomach. And as a result of that, he would have 2 or 3 bites of food and then he would just be full. He ended up having frequent infections. He was really just not David anymore. And by the time I told him he had hairy cell leukemia, he kind of looked at me puzzled as to is that the best you can do? And I told him, no, it's a very rare cancer, but luckily you are one of the few lucky patients that is here at a time where simple bone marrow biopsy can show us these abnormalities in your bone marrow, and then I can give you a pill for your condition. We check them for what are called clusters of differentiations. They come in different numbers, and he was blessed enough to have BRAF or BRAF V600, which is a rare form of hairy cell leukemia, but we have a pill that's a targeted medicine that we could offer our patients, and he was gracious enough to agree with me. We ended up giving him his medicine, and he actually did quite well. Uh, in some patients that do not have the BRAF mutation, like many that I've had in the past, we use a medicine called rituximab or rituximab, and generally within a few months, patients do quite well. To make the long story short, when David came back to see me, I really didn't even recognize him. The color was back in his face, his blood count was fine, his infections had disappeared, and he actually smiled. And he told me, Dr. Eson, I fished all weekend and I finally had enough energy to chase my granddaughter again. I guess those are the moments we all live for, and this is why I love being a cancer doctor. So I'm doing this video past my bedtime. I just want everyone who's watching this video to know that if you have been diagnosed with hairy cell leukemia, take a deep breath. It is frightening, but it's one of our secret weapons where we can give you a pill or an injection and get you back to normal for most cases. As best I can tell, David was able to have a birthday. He celebrated his anniversary, and he was able to spend more time with his grandkids. So my message is somewhat late at night, but it's simple. Don't let the word leukemia define your future. Learn about your disease, whether it's hairy cell leukemia or non-hairy cell leukemia. There are treatments out there, and oncologists and hematologists like myself, we really get up in the morning with the hopes of finding a patient who's anxious and hopeless and try to help them understand what they're going through. And we're grateful that you do trust us as a part of this journey that the good Lord has presented you with. Uh, if I'm your oncologist, David, I'm gonna look forward to seeing you in about a month and we'll recheck your blood test. And I sure don't want to see any more hairy cell leukemia. And if you are not my patient, I really hope that you don't have cancer, first of all, meaning I never want to meet you. And if you do have cancer, I'm sure you have a great group of physicians taking care of you. This is simply my way of educating my own patients. So trust your team, trust your doctors, and I wish you the best of luck. And I hope that you don't lose faith when someone tells you you have leukemia, and you do understand that leukemia is something nowadays that in many instances can be treated with a pill.